everybody. My name is Dr. Apurv and I represent team Conceptual Orthopedics. I will request all the respected teachers to please come on the stage and do the lamp lighting.
The future lies in the hands of younger generations who should find it's being discussed all over the world. The new generation, the younger generation, the smart generation should find ways and means to treat injuries and fractures by less invasive techniques. Repair bone with bone, cartilage with cartilage. Create cells in your places of work which produce multipotent regenerative cells to regenerate bones, cartilage and other parts of the body. And that lies in the hands of all of you to work so that we can prepare situations and solutions for treating many orthopedic problems. I belong to a generation, not many varieties of implants were available. Even today, if you look at any fracture for that matter, it can be treated by closed method. There are books written, non-operative treatment for fractures. International book is available. And if it comes to operative intervention, you have plates, screws, curved plate, T-shaped plate, rods, intramedullary rod, intramedullary bone grafts. I think the whole aim of any treatment according to your thinking should be, let me do something to optimize the process of healing. Fractures have been healing since the arrival of human animals on the road. Fractures have been healing. Most of the fractures heal even without an operative intervention. However, any intervention should aim at optimizing the biological process. And today you have the options of so many varieties of options. Pick up the one which is the best for the patient. I would just make that remark, and that remark is applicable to any fracture, any treatment. I think another sentence I'll just pass on, which is applicable to any fracture. Any implant will break unless the underlying fracture does not undergo healing in critical time. Put the critical time in inverted commas. Start learning what is the critical time. Any fracture, any metal will break, whether it's an intramedullary rod, it's a plate or a combination. All of them can break unless the underlying fracture or underlying unstable fragment of spine does not get stabilized in the critical time. So you will see all this during the journey of life.
I think this course is more focused on the biomechanics, how the biomechanics helps in healing of the bone. But there is a larger dimension to it, which all orthopedic surgeons are aware of, but we tend to forget about it when we are fixing bones, and that's the biological aspect.
I think you need to understand that somebody has a passion to do it. किसी एक को ये सब करवाने के लिए पागलपन की तरफ पे आप उतरना पड़ता है. Everything that you see here, which we are able to do that, just to let you know that this is something he dreamt of, and he was very clear. हमें से किसी को अभी तक नहीं पता क्या हो रहा है. तो आप में से कुछ समझ आना शुरू होगा, right? But he is the only one who knows the entire picture and he knows the end, right? So शैलेश सर, हम सब बहुत thank you बोलना चाहते हैं इसके लिए आपको. And I am very happy that each being shouldered by two individuals. Fahim and Vishal, please come.
Professor Tuli sir, Professor Dhal sir, Professor Basir will see you in these 3 days. Professor Kumar also will be here. Dr. Timmy is in UK, but he's missing you both. So these are people who are always there, day in, day out. आप सोचिए डॉक्टर शैलेज एंड फहीम दे वर्क एट अ सेटअप. सो इनके जो सीनियर्स हैं वो उसको भी मैनेज कर रहे हैं, डॉक्टर हीक एंड डॉक्टर शांताराम शेट्टी. दैट इज सपोर्ट कंसेप्चुअल हेल्थ. सो हम कुछ भी अनाउंस करते हैं इसका एक पीछे का सपोर्ट ही होता है. ठीक है. They are so guys, 4 young guys who has traveled, and it is such a good thing. Sharish, we feel it today that we all are absolutely this week on the same place. So very important. We have Keshav, Pisa. We have Manshu, please come. We have Pulkit and we have Pata. And obviously we have 2 young guys, Yogesh and Nishan, will be working tirelessly for this. Often we are. And 4 seats kicked asses. It's an unmanned fire. जब ये लगे हुआ है वो कैसे plumbier, plus से कभी reached out. And also there's somebody who's been कहाँ गया? अब क्या he has been there managing Conceptual for so many years, and now he moved to Abu Dhabi. And we requested him to be there, and even more than Ilamka. He's passed Dr. Naufal हाथों पे करते week को. So इतना रटेगा कि अब तुम्हें एक चीज़ हॉट है देखो टीम है, बट पागल कब तक सपना में डॉक्टर शरीफ थे.
Please, as we all say, please get your all queries answered. You have all the experts here. Whatever doubts you have, please get them answered. You are here to learn from the experts by doing things, by observing things. So do them, see them, and ask questions.
Interaction should be at the forefront. Do not go back with any doubts, and like we always keep telling in Conceptual, there are no silly questions. The bonus is on us not to use silly answers. Any doubt you have, pretty sure many of you others also may be having. Okay, so get the doubt clear. Let this not hinder your performance when you are going to be treating on the patients. Right? So whatever it is, so there are multiple formats. You can stop us, ask questions. Some of you who may be hesitant to do that, you can ask on Telegram Pinnacle group that you are all a part of. Some is not a part of. Please join the group because discussions happen there, because it's going to be a conditioning of online learning. Okay, so be a part of Telegram group. You can use that also to ask questions. Feel free to ask any questions that you want. You can drop us even during coffee breaks, lunch breaks. We don't mind that. Okay, because all of us are here to learn. Many of the questions sometimes even we learn. We might not be able to give you the answer right then and there, but we can always go back, learn about that. So even we get a opportunity to learn. Okay.
Now we move on to the practical exercise. Before you move on, leave all your things over here, book, pen, whatever you have. Nothing needs to be taken to the practical exercise.
you draw a perpendicular line from here, if it is coming something like this, that means it has completely broken on this.
Now when you put your triple reamer, if your fracture length within this zone, you're going to blow out that.
There's going to be a long practical exercise because there's going to be a good learning experience with regards to reduction, the different reduction parameters that you went through in the previous lecture, how to assess the flexion extension of the distal femur block, and also we are trying to compare the concept of bridge plating. Then you put two rod-to-rod connecting clamps and you pass the third rod to it. Then the first assisted holds, gives traction, gives axis correction, gives rotation correction. All of this is clinical. You don't have to take X-rays. You don't have to take X-rays for the entire X-fix application.
Behind the 2 days of work, what you have seen has been a lot of thought process by Dr. Shailesh and so big round of applause for Dr. So I still remember when we did our first foundation course, trauma foundation course, the thought process of what he wants to do in the pinnacle course. We already had a clear idea. None of us. But I remember sitting down and with him in 2022, about August, September, at the Hyderabad airport, the pen and paper, trying to finalize or visualize what we want to do right here. So you take what you have seen in these 2 days, took, so we are talking about August 22. So today is February 25.
And you cannot even purchase the space at that. ये जगह भी नहीं मतलब तब से सोच रहे हैं जगह भी imagine मैं आपको अलग बता this was a barren land when I purchased it way back in October 2020 okay 100,000 photo left but Shailesh sir ने program decide कर लिया ये पूरी building बन गई और pinnacle course building ही रहेगी right Pinnacle course दुनिया में हर जगह that is the power of education. So with what he just said, I will explain to you. ये सलमान खान के फादर ने बोला है सलमान खान के फादर सलीम साहब ने बोला है that लक्ष्मी माँ
भगवान के पास नहीं, थोड़ा वरदान दो। कहते क्या चाहिए? कहते मुझे ये वरदान दो कि मैं जिसके पास भी जाऊँ मैं उसकी जिंदगी बदल सकूँ। तो भगवान ने कहा आपको ये वरदान मिला, बट देने की शक्ति आपकी, लेने की नहीं। सो लक्ष्मी माँ किसी के पास भी जाती है तो जाती है, पर अगर भगवान चाहे तो 1 मिनट में गायब टक। अब ये देख के ना लक्ष्मी माँ को इतना बड़ा वरदान मिल गया कि अपनी मर्जी से किसी को भी अमीर कर सकती हैं, जिंदगी बदल सकती हैं। तो सरस्वती माँ ने बोला मैं भी जाऊँ। तो सरस्वती माँ गई। तो सरस्वती माँ गई तो हमने भगवान से पूछा जी मुझे भी वरदान। तो भगवान ने बोला तुम बाद में आई हो, तो तुम्हें बड़ा वरदान दे दूँ। तुम जिसके पास भी जाओगे, राइट, वापस लेने की शक्ति भी मेरे पास नहीं है, और जितना वो इंसान इसको और आगे बढ़ाएगा उसको भी ये शक्ति और बढ़ती जाएगी। दैट इज द पावर ऑफ सरस्वती माँ। तो लक्ष्मी माँ खर्च करने से कम होती है, सरस्वती माँ बांटने से बढ़ती है। दिस इज व्हाट सलीम खान सेड, दिस इज व्हाट यू हैव टू अंडरस्टैंड। सो ये जो कूंज है, दिस पिनैकल कोर्स व्हिच हैज बीन ऑर्गेनाइज्ड, बूटस्ट्रैप्ड कहते हैं। बूटस्ट्रैप मतलब अपने दम पे दिमाग लगाना, दिमाग गर्म करना, सोचना, इमेजिन करना, उसको ऑर्गेनाइज करना, राइट। इट्स अ ह्यूज मेमथ ऑफ एन एफर्ट, इट्स अ मेमथ ऑफ एन एफर्ट। मतलब आप सोचिए इस बिल्डिंग में 200 लोगों ने जो करके दिखाया वो उनके अकेले दिमाग ने करके दिखाया। डॉक्टर शैलेश का है, इज देयर, राइट। सो उन्होंने अकेले करके दिखाया। एंड प्लस आप सोचिए यू आर एज गुड एज योर टीम। आप दुनिया में अगर अच्छा करना चाहते हैं पढ़ाई करिए, बड़ा करना चाहते हैं एक ऐसी स्किल सीख लीजिए दुनिया के पास ना हो, बट अगर आप सबसे बड़ा करना चाहते हैं तो एक टीम बनाइए। सो ही हैज डेवलप्ड अ टीम of his own students who are now the table instructors and faculties along with his co-consultants Fahim and Vishal, right, and Harpreet. You know, Harpreet has been coordinating everything selflessly, right. That's he's rightfully the backbone of CO Conceptual Orthopedics. So that's what he's been. हम सिर्फ इसको बोल देते हैं भाई तू ये कर दियो and he managed everything on it. So 3 cheers for him. आ गए शैलेश सर यार, एक बार खड़े हो जाओ यार, खड़े होकर ताली बजा दो। बैठ जाओ, थैंक यू।
So, as a concluding thing, I would like to thank a lot of people. So there's a big list. Firstly, this entire platform here of Conceptual Orthopedics, Dr. Tuli. Basic, very trivial to be thanking, but this platform has given us, given the idea of having this course its roots, and now it has grown onto a small tree, and we are planning to grow into a large banyan tree under whose shadow a lot of us can come and grow and make a big community of great traumas and also make trauma greater. Okay, so of course, we'd like to thank the man here on my left, okay, because there was never a no to anything. If the idea was there, he's like executed. There was no discussion about. He's like the faith he had shown in our ideas was amazing. Okay, I mean, like blindly, even I would not trust myself as much as he has trusted us in all our life. This course has not happened earlier because a lot of these things, the sawbones and all, have come from abroad. They're not from India. So we tried ordering them last year. We couldn't get them here. They got stuck in customs, and they're still somewhere in Delhi customs in a locked box, which is not cleared because of some reason. We don't know how. But then it's repeated trying by him, his entire team, and eventually he got them here. He got them here by hook or by crook. And we have had a sawbone. It was a wonderful experience. The experience you get while drilling these, while hammering these, are as close as to reality as is possible. Okay, is world class. You will not get better than these anywhere else in the world. Okay, this is from 3 years. We had our instruments come in about 2 years back. We had the sawbones coming in, keeping the inventory, shifting into multiple places, having these trolleys or tables ready. the entire setup, had you come back here 2 years back, you would have never thought this place would have hosted a trauma course in 2 years. That's how much work has gone into this entire course. Dr. Harpreet, we are in Bangalore, but Dr. Harpreet has been our hands and eyes, our brains to work, our first contact for everything that has to go through from us in Bangalore all the way to Conceptual Orthopedics in Delhi. The rest of the team, Dr. Vishal, Dr. Naufal, who has come all the way. It's not really easy to come for say 6-7 courses via different places and still have the enthusiasm to teach for 2-3 days and then go back. It's all our table faculty, Dr. Nishant, Dr. Himanshu, Dr. Pulkit, Dr. Yogesh, Dr. Gautam and Dr. Keshwendra Verma. So all of these people, they readily agreed to what we were going to tell and they came forward, and it's the starting of a new experience for them as teachers, and we hope you are here for the next courses as table faculties. You show your interest, say 2-3 years down the line, we want you here so that they can come here and we can go there. Okay, so it's a ladder. We want you to grow as well. This is not an end. It's only a journey. We are all going to get older. Okay, so we have to teach you so that you can teach the next generation. And of course, last but not the least, the man. Okay. The amount of serious that you had in the last 3 weeks, I just cannot fathom. I had last week of sleepless nights, but he has been working. I don't know how to tell things nicely. I'm trying to use it. Okay. He has been trying to work day and night. He's toiling so hard that all that you saw in all the case discussions is easily about 25 to 30 years of a trauma surgeon's experience, and he's only had about 12 years of trauma surgery experience. Okay. The knowledge that is there, you will not get it in 30-35 years. That's your entire lifetime of trauma experience. It's not easy to compile everything, give everything so much knowledge, and that's why, forget you people, even I find it difficult to grasp so many things. Out of 200, I have grasped 60. You may have grasped 50. We'll come back again. I will come back again. I will learn more from him. Okay. Hopefully by that time he has reached 300. Okay. So we'll still lag behind. But we'll still learn more. Okay. So that's it.
The 3-day Pinnacle Course workshop I found very useful. Especially Sailesh sir's approach, the algorithmic approach, I found it to be very useful, especially when it comes to the shoulder.
One message I must like to say that it's a must joining course for all. We do things, so many things in our daily day-to-day practice, but here we know that how we do it properly.
All the workshops were thoroughly discussed. The faculty was available on the table. They were there to solve all the queries regarding any doubts you can ask here.
So everything was explained nicely, and simple to complex type of cases were also explained and given a good examples. So I recommend every orthopedic surgeon to attend this type of courses.
This is the 3rd day of the Pinnacle course, and I actually finished my residency 2 days back, and I'm starting my surgical life with this course. And I believe this is a great onset for anyone who's progressing into orthopedics, as everything is very well curated over here, very well thought of, and we learned all the nuances and the ins and outs and what to do and what not to do while dealing with trauma.
They build upon the concepts which were made during the basic course, and this was a more advanced version of that course.
According to me, I can say that these things we can't get on a single platform. So Conceptual Orthopedics, they gather all the topmost faculties, and with the help of information technology,
all my basic doubt that which I had are cleared with this course, and I would recommend every postgraduate student to take this course.
My experience with the Conceptual Orthopedic app is very great. The knowledge which we are getting it from here, it is unmatchable. And the things which we are getting, it is very concise knowledge of many 30 years, 40 years of experience we are getting from so many professors, which is unmatchable.
We learnt a lot from this, and going forward, applying this and how to go forward in every case, they explained us. And also there was a hands-on session. So whatever we are doing, we could do it practically also on the saw bones, and all the implants that they had and the saw bones they had was best in class. So overall, this was a wonderful experience of one of a kind course at this level. Thank you.